Difference between periapical abscess and periodontal abscess. Look at this picture shows that and radiographic findings detail going on. Periapical abscess. It is a localized infection at the top of the tooth root, typically caused by untreated dental cavities or trauma, leading to buildup of pus and severe pain. Periodontal abscess. It is a infection in the gum tissue and supporting bone around a tooth, often associated with advanced periodontal disease, leading to swelling, pus formation, and discomfort. Difference between definition. Periapical abscess, a localized infection at the tip of the tooth root, typically caused by bacterial invasion from a dental cavity or trauma. Periodontal abscess, an infection in the periodontal pocket, which is the space between the tooth and the gum, usually caused by periodontal disease. To location, periapical abscess occur at the apex of the tooth root. Periodontal abscess occurred in the gum tissue and the supporting bone around the tooth. 3 causes. Periapical abscess usually results from untreated dental cavities that extend to the bulb, leading to infection. Periodontal abscess, commonly associated with advanced gum disease, where pockets from between the tooth and gum, allowing bacteria to accumulate. For tooth vitality, periapical abscess, the affected tooth is typically non-vital due to bulb necrosis. Periodontal abscess, the tooth may be vital unless it is also affected by severe periodontal disease. 5. Pain. Periapical abscess pain is usually sharp, intense, and localized to the affected tooth, worsening with pressure or biting. Periodontal abscess pain is often dull and throbbing and may be associated with swelling and tenderness in the gums. 6. Swelling. Periapical abscess swelling is typically localized near the tooth tips and may extend to the face or neck in severe cases. Periodontal abscess swelling is usually confined to the gums and can spread along the gum line. 7. Radiographic appearance. Periapical abscess appears as a radiolucent areas around the apex of the tooth and an X-ray indicating bone loss. Periodontal abscess appears as a radiolucent area along the sides of the tooth, root associated with periodontal bone loss. The 8. Gum packet depth. Periapical abscess typically does not involve deep gum packets. Packets depth is usually normal. Periodontal abscess involves deep periodontal packets where pus can accumulate. 9. Gum attachment. Periapical abscess. The gum attachment near the affected tooth is usually intact. Periodontal abscess, the gum attachment is compromised, leading to detachment and packet formation. 10. Pus drainage. Periapical abscess. Pus may drain through a sinus tract that opens into the oral cavity or skin. Periodontal abscess. Pus typically drains through the periodontal packet or occasionally through the gum tissue. 11. Tooth mobility. Periapical abscess. Tooth mobility is not usually present unless the infection has caused significant bone loss. Periodontal abscess tooth mobility is often present due to the loss of supporting bone and tissue. 12. Treatment. Periapical abscess treatment often involves root canal therapy to remove the infected bulb or tooth extraction if the tooth is not salvageable. Periodontal abscess treatment focus on drainages of the abscess, scaling and root planning to clean the periodontal packet and possibly periodontal surgery. 13. Systemic symptoms. Periapical abscess more likely to cause systemic symptoms such as fever, allergies, and swollen lymph nodes. Periodontal abscess systemic symptoms can occur but are less common unless the infection spreads. 14. Recurrence. Periapical abscess recurrent is possible if the root canal treatment is not successful or if reinfection occurs. Periodontal abscess recurrence is common if periodontal disease is not adequately managed. 15. Associated conditions. Periapical abscess often associated with deep crisis, dental trauma, or history of previous root canal treatment. Periodontal abscess commonly associated with chronic periodontitis, poor oral hygiene, and in some cases systemic conditions like diabetes. Thank you. Have a nice day.